This presentation outlines the basic ideas behind the Optimum Performance Living, the CIMH Method. The basic idea is that there's a target that you look at as a particular state in time. Here we see that the object, we see stage 0, disease, preventive medicine, and then the risks out on the rim. What we look at in terms of this idea of the goal being preventative is a limitation. We prefer the concept of optimum performance living, which we describe in our materials. So when you take a snapshot, you're really looking at not only the diseases but the objective in terms of optimum performance living. We see here a well-being index, which is an average of vital signs, which is system analysis, biological assurance, and physical measures, which are measures of strength and mobility. That these brought together form the target, with optimum performance living as the goal. By focusing on this, and by focusing on improved means of using information, you can increase the size of the target. How can this be done? We say, number one, need to capture the knowledge of individuals in a systematic way. Need to have a large-scale testing regimen. You need to be able to use that information not only for disease purposes, but for health. Provide triggers, provide advisement when there are problems, give the doctors as well as the people themselves guidance. So when the people need to go to the doctor has the guidance to know what to do, and that guidance is supported by the data, and that data then folds back into the system so that there's a common round. And using technology, the data is available so that these reports that are provided, we can get more green results than yellow and red results. The idea is to get the red out by evaluating the systems. Quantum epidemiology is an area that we look at in terms of ongoing gathering of data and using an observatory. This then provides an environment where the target focuses on optimum performance living, and then you have groundings for increasing the size of the bullseye so that optimum performance living is more easily achieved. And the chances of contracting high-risk diseases and mid-range diseases is much less. So when you take a snapshot at any point in time or a study, you're going to have more of a chance of landing in a good place. And of course, if you have optimum performance living as a goal and an infrastructure to support that, that allows you then to introduce performance-based measures, which would be athletic or sports or active development of various kinds. We use the Olympic model here to say that you have a bronze or a silver or a gold kind of objective with regard to your life, regardless of the stage of your life, so that when you take a snapshot, you're going to stand to have improved results. And for that matter, you can crop the results by utilizing that information that's available to individuals and to doctors. We indicate that this is based on both smart science and smart policy, that these are woven together using tree-based technologies so that you can achieve the best kinds of results. We show here the Piotrkow Tower. When we've seen the avalanche of articles promoting people-centered integration, etc., we see no attempts to operationalize this. This program, the 2020 program, is a means of operationalizing this. People-centered integration, knowledge swirl, which can be described the pathway to reach organizational wisdom, dual control and fluidity. This means combining knowledge and authority. Disease prevention through optimum performance living. Operationalize with an integrated payment model so that you have an institutional manner of achieving personalized medicine, really a custom system for each person to eliminate the causes and the incidence of disease, and to increase the prospects that someone is going to have a healthy lifestyle through the lifestyle. Once again, as we look at these two areas, smart systems, including smart networks and authoritative networks, really in terms of intelligence and expertise, that's in a network form, and others are in the form of organizations. So we can see this method is a means of providing knowledge-driven universal coverage to achieve optimum